Are you finding yourself running to the bathroom way more than usual? It might feel like you're living in there at this point. But don't worry, you're not alone. Excessive urination, also known as polyuria, is defined as the production of abnormally large volumes of urine, typically more than 3 liters per day for adults. While it might seem like a harmless issue at first, excessive urination can lead to dehydration, disrupt sleep, and indicate potential problems with the kidneys or endocrine system. In this video, we'll reveal the potential causes behind why you're peeing so much. Is it something as simple as what you've been drinking, or could it be a sign of a medical condition like diabetes or an infection? We're covering it all, from lifestyle factors to serious health concerns. So stick around. You'll be surprised at how much you can learn about your body and what it's trying to tell you. Now, without any further ado, let's get to it. Number 1. Use of diuretics. If you suffer from high blood pressure, heart failure, or certain kidney disorders, there is a good chance you were prescribed a diuretic at least once. Diuretics are medications that promote the excretion of sodium and water through urine. This can help lower the blood pressure, decrease the workload on the heart, and support the kidneys. These diuretics work by inhibiting the reabsorption of sodium in different parts of the nephron, which is the filtering unit of the kidney. However, by preventing sodium reabsorption, diuretics cause water to be pulled into the nephron to balance out the excess sodium. Consequently, water is retained in the urine and is excreted in larger amounts. If we take a look at the studies published in the Journal of Clinical Pharmacology, we will find a study that involved administering different types of diuretics to healthy volunteers and patients with high blood pressure. After that, researchers measured changes in sodium and water excretion using urine analysis and blood tests. After examining the data, the study found that diuretics increase urine output by inhibiting sodium reabsorption at specific sites in the nephron. Approximately 95% of participants experienced an increase in urine output following diuretic administration. Number 2. High calcium levels in the blood. Hypercalcemia is a condition characterized by elevated calcium levels in the blood. High levels of calcium can impair the kidney's ability to concentrate urine by affecting the function of the kidney tubules. This is because calcium interferes with the action of the antidiuretic hormone on the kidney tubules, which reduces the reabsorption of water. In addition to that, calcium can cause direct damage to the kidney tubules themselves, further impairing their function. The result is an increased production of dilute urine, leading to increased urination. Number 3. Diabetes. Diabetes, particularly in uncontrolled diabetic patients, leads to high levels of glucose in the blood. Normally, the kidneys filter glucose and reabsorb it back into the bloodstream. However, when blood glucose levels exceed a certain threshold, the kidneys can't reabsorb all the glucose. So when the blood glucose levels are beyond the kidney's capacity, the excess glucose spills over into the urine. The problem with the presence of glucose in urine is that it doesn't go alone, but it pulls water from the blood into the urine along with it. This increases the volume of urine and leads to excessive urination. The excessive loss of water can lead to dehydration, which further stimulates thirst, and the cycle of excessive urination continues. According to some estimates, approximately 80% of patients with uncontrolled diabetes experience this symptom. Number 4. Diabetes insipidus. Diabetes insipidus is a condition characterized by the body's inability to properly concentrate urine, leading to excessive urination. There are 2 main types of diabetes insipidus: central diabetes insipidus and nephrogenic diabetes insipidus. Central diabetes insipidus occurs due to a deficiency in antidiuretic hormone, which is a vital hormone for water reabsorption in the kidneys. Without the antidiuretic hormone, the kidneys don't reabsorb water from the urine back to the blood. As a result, a tremendous amount of water is lost in urine. On the other hand, in nephrogenic diabetes insipidus, the level of the antidiuretic hormone is normal. However, the kidneys are unresponsive to it due to a defect in them. This leads to the same outcome as central diabetes insipidus. In the New England Journal of Medicine, a study was conducted which examined both central and nephrogenic diabetes insipidus patients. Tests were used to assess the kidney's response to the antidiuretic hormone, and their urine was analyzed. According to the results, a lack of antidiuretic hormone or insensitivity to antidiuretic hormone results in large volumes of dilute urine. Number 5. Psychogenic polydipsia. Psychogenic polydipsia is a condition where an individual has an excessive, compulsive intake of fluids, often water. The excessive fluid intake overwhelms the kidney's ability to concentrate urine, leading to excessive urination. One thing you should know about the antidiuretic hormone is that it's normally secreted when the blood is concentrated. In simpler words, the antidiuretic hormone is released when the fluid levels in the blood are low compared to the level of salts. So when the fluid levels in the blood markedly increase, the antidiuretic hormone secretion is suppressed. This suppression further reduces water reabsorption in the kidneys, resulting in increased urine output. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Chronic kidney disease. In the early stages of chronic kidney disease, the kidneys lose their ability to concentrate urine due to damage to the renal tubules. This loss of concentrating ability leads to the production of large volumes of diluted urine, causing too much urine to form. As chronic kidney disease progresses, the kidney's filtering ability declines, but the tubules continue to lose their concentrating ability, leading to the characteristic increase in urine output during the early stages. In the Journal of the American Society of Nephrology, in 2008, a study showed that 60% of patients with early-stage chronic kidney disease exhibited impaired renal concentrating ability, leading to a 30% to 50% increase in urine output. Number 7. Cushing syndrome. Cushing syndrome is caused by prolonged exposure to high levels of cortisol, either due to overproduction inside the body, such as by an adrenal tumor, or due to excessive supply from external sources, as in long-term corticosteroid therapy. Cortisol has a mild mineralocorticoid effect, meaning it can lead to sodium retention and potassium loss. The loss of potassium can impair the kidney's ability to concentrate urine, leading to the production of great amounts of urine. Moreover, cortisol can reduce the sensitivity of the kidneys to the antidiuretic hormone, further contributing to excessive urination. A 2006 study found that 80% of patients with Cushing syndrome had impaired renal concentrating ability due to elevated cortisol levels, leading to a 40% to 60% increase in urine output. The loss of potassium, observed in 70% of patients, contributed to further impairment of urine concentration and abnormal urination. Number 8. Hyperthyroidism. In hyperthyroidism, the thyroid gland produces excessive thyroid hormones, T3 and T4, which increase the metabolic rate and result in increased blood flow to the kidneys. This elevated blood flow increases the rate of filtrate formation in the kidney tubule, leading to an increase in urine production. Furthermore, hyperthyroidism can cause an increase in thirst, leading to higher fluid intake and further contributing to excessive urination. Around 75% of patients with hyperthyroidism experience an increase in renal blood flow by 20% to 30%, leading to a 30% to 50% increase in urine output. Number 9. Medications. Several medications, apart from diuretics, can cause polyuria as a side effect. For example, lithium, often used in the treatment of bipolar disorder, can lead to nephrogenic diabetes insipidus by damaging the kidney's ability to respond to antidiuretic hormone. A study assessed kidney function, urine concentrating ability, and lithium levels in patients on long-term lithium therapy for bipolar disorder. The study found that 40% to 50% of patients on long-term lithium therapy developed nephrogenic diabetes insipidus, characterized by a 50% to 70% increase in urine output. After cessation of lithium therapy, 30% of patients showed partial recovery of kidney function, with a 20% to 30% reduction in urine output. Similarly, certain chemotherapy drugs and antibiotics can have nephrotoxic effects, impairing renal function and leading to increased urination. Number 10. Pregnancy. During pregnancy, the body's fluid balance changes, and the kidneys are required to process an increased volume of blood. This increased workload on the kidneys can lead to increased urine production. Not to mention, the growing uterus can exert pressure on the bladder, leading to more frequent urination. According to data from conducted studies, 90% of pregnant women experienced a 20% to 30% increase in urine output during pregnancy. Additionally, 80% of women reported frequent urination due to the growing uterus exerting pressure on the bladder. So, these were the top causes of excessive urination and everything you need to know about it. Now, we want to hear from you. Have you ever experienced excessive urination? What was the cause? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.